What's good, everybody? My name is Dr. Alex Samuel. I'm a physical therapist and the owner of Ascend Physiotherapy and Performance. Today, I'm super excited for two reasons. One, it's Friday, and two, I'm joined here with my good friend, Dario. Not only is Dario my good friend, he's a successful entrepreneur and a reality TV veteran. Just this past week, his latest appearance debuted on MTV, The Challenge All-Stars Rivals. Dario, thanks for being here, bro.
Thanks for having me, bro. Let's go. Be back in here.
Yes, sir. Yes, sir. So, being that this is a physical therapy channel, I really want to shed some light on the experience that Dario had here at Ascend and how physical therapy benefited them in competing on this season of the challenge. So, bro, I want to just give the audience a background as to when you first experienced that knee pain, and you let me know about it, bro.
So the knee pain initially, I want to say it was when I first moved to Florida. I started to run frequently, and I noticed after my runs, my knee was almost like giving out, and I never experienced that before. So it had to have been because of the running, but regardless, it was probably about 9 months ago. And once I started to experience the knee pain, I really didn't say anything to anyone. I just kind of kept running, like a lot of people probably do, just kind of ignore the pain. And then I talked to you about it, and right around that time, the challenge called. So I knew if I was gonna have any shot at competing at a high level with regards to like the physical activities, the challenges, whatever they had us doing, I was gonna have to figure this out. So that's when I hit you up, or I at least mentioned it to you. I don't think we started working together just yet. I then went and tried to look into like x-rays or MRIs, which I know we'll talk about. But that's when it started. I was running significantly more, and I noticed knee pain after the runs.
Yeah, dude, I remember, I think we were watching like Clay basketball at your crib. And then you're like, yo, Alex, my knee, bro. I went running and it hurts to run. It even hurts sometimes when I walk, and it feels unstable, like you were saying. And I was like, oh, geez, man, like what else have you been doing? And I remember you even told me you spent $900 on the MRI, and you were pissed because nothing came of it. Like there was no damage to your knee. Like they told you like, no, your knee looks perfectly fine. And I know for a lot of people out here who maybe are experiencing knee pain or shoulder pain, or, you know, have spent money on MRIs and they've seen that nothing was wrong with them. And it's almost like a bittersweet moment, because you're a little bit relieved that, okay, I don't need some major elective surgery on this joint. But at the same time, it's like, I feel a little crazy and I have no peace of mind, because why am I in so much pain if they're telling me that there's no issues with my joint? You know, so I feel like that's where you were at. And I was like, okay, well, it definitely is something to do with the increased activity that you've been doing. But yeah, worked together, yeah, we got the thing done. And
I think you put me through exercises right then and there, abs.
Oh, yeah, for it.
We were like, you immediately got into work mode. But yeah, these things are easy to ignore. And I think like I was frustrated because I spent money on what I thought would appropriately diagnose me. It did not. The pain didn't go away. The issue wasn't resolved, and I was $900 out. So, you know, it's easy at that point to just say, oh, it's fine, and keep ignoring it. So yeah, I'm glad we got in here.
Yeah, bro. And that's like a huge thing. So like on like the whiteboard I have over there, so a lot of times I'll have new patients come in, and in that same scenario, there's this one knee surgeon. His name's Scott Dye. He's up in San Francisco, but he coined this term envelope of function. And it's super cool because literally like tissues need balance, they need homeostasis, right? And you can get hurt by not stressing the tissue enough. You can also get hurt if you overstress the tissue. So finding that envelope, like that fine line of not too much, not too little, which is what physical therapists are capable of doing, is how you were able to, you know, get the knee right and compete at a high level and go on that show. So happy we were able to get that done. And here at SMPT, like, I want to make a note too that we are all about movement-based solutions. So, I mean, the proof was in the pudding. You saw how my man Dario had his issues, but we were able to work through that and he was able to achieve his goal. And I think we worked together for literally, 2 weeks, bro?
Yeah.
We did maybe like 4 sessions.
Yeah. And I mean, you gave me, not only like, did I feel like when I was in here that the sessions were very active and helpful, but you gave me tools to take with me on the show. As far as like, hey, if you continue to go through this program and do these things, then even though I'm not with you in person, I can still be of value. And when I was on the show, I really I remember forgetting that I had a knee problem.
Let's go.
And, you know, I brought bands with me. Bands were a part of the program. Like all those things I would not have been able to do by myself. So looking back, like the best thing I could have did was come in here. The worst thing I don't even want to say the worst thing. The MRI, like, I guess it gave me peace of mind for sure. But at the same time, it's only half the battle. There was still this whole other part. And it really came down to the physical therapy and like getting in with a professional. So like, you helped me so much, bro. It was a lot.
Happy to be of service, man. Happy to be of service. So I got a little Q&A on, you know, physical therapy and how it tied into how you were able to prepare for this show. So my first question is, were there any specific, you know, workout routines that you did prior to going on the show to help you prepare for the physical demands that you were gonna perform?
Not really. You know, the show, there's a bunch of different aspects. A lot of it's like endurance based, running, biking, swimming. Some of it's, you know, you're jumping from platform to platform. So as far as preparation, other than trying to get big and look like intimidating, which I did a terrible job at, I didn't do much to prepare. So once I felt like, okay, I actually have a physical disability here with a knee, I got to figure out like, how am I gonna be healthy? So
sure.
The only preparation I ever had going into a challenge was literally the program you gave me to help with my knee pain. Other than that, I was just like, how much can I bench and curl?
Yeah, that's interesting to hear, man. Because, I mean, I look at some of the stuff you guys do and I'm like, yo, is there any like physical preparation test that they put you guys through before you can become a cast member? Like, I'm thinking of...
Yeah, no, there is, and don't get me wrong, guys are training, and I went through seasons in the past where I did train, but there is no requirement by the network for the people they're casting as far as their physical ability. They actually, I feel like they want to see some people just like collapse and not be able to do the damn thing. So no, there's no requirements, and people know. I mean, you can physically look at someone and tell that they're not in shape, and you'd think like, you guys are on the challenge. Like, it's not like you're gonna be doing puzzles every week. So why wouldn't you be prepared? But no, there's no requirements, and a lot of people show up slouchy. And I have in the past too, so I'm not even just gonna point.
Sure, because this is what, your fifth?
Yeah, it's been 5 years since my last one, but Rivals was, All Stars was my 5th season.
Nice, bro. All right, next question is, what was the hardest obstacle on the show and why?
Hardest obstacle in the show, you know, I would say it wasn't even anything anything related to physical activity. One of the hardest parts about the show is the politics and the manipulation and like being able to strategically make moves and get what you want out of people. And it's one of those shows where it's like people backstab, you know, there's just a lot of, one way or another, you have to be this like slick person. And that's very difficult to do. Shows like Survivor, if you look at people that win, Big Brother. There is a form of politicking, and that's a skill. And I feel like I'm terrible at it. So
That's interesting, man, because you do bring up a great point, right? Like at the end of the day, like it's physical challenges, but it's still reality TV, you know, and you're still competing for a large sum of money. So absolutely, like there's alliances that come into play, and you got to play your cards right.
And what a lot of people don't see is, let's say you make a move, or you make a decision that's going to negatively impact someone else's game. We're watching it as a viewer, and then you're going about your day. You're going to bed, no repercussion. When you make that decision on the show, now you got to go back into a house. They're your roommate. You're seeing them in the kitchen. You're seeing them upstairs for days before maybe there's an elimination taking place and they go home. What if they don't come home? You got to ride on the bus with them. So there's like all these interactions. So imagine like you just made a decision that could send someone home or potentially can hurt them. They really need the money. And now the cameras are off, or not off, they're never off. But now that set is over. And now you're going back into the house. Now it's awkward. Now they hate you. Now they want to throw eggs at you. Okay? Like it's uncomfortable. And that's what viewers don't see. So it's easy to say, oh, why didn't you make that decision? But these are the things you're kind of weighing. It's a show. And so a lot of people don't take it that way while they're there. It's life or death, and it creates so much more drama.
So how you liking the recovery boost, bro?
Dude, this is my first time putting these on. It's squeezing the life out of me, but I know it's doing its thing. They feel good.
For sure, man. And that leads me into my next question. Like on the show, you know, being that you guys are doing these physical challenges, were there any recovery tools that you guys had access to out there?
No recovery tools.
No Theragun.
Well, you can bring your own. There was a couple people that did have Theraguns, and there may have been someone that had something similar, but this is like personal stuff that they brought. The show, or MTV, or whoever, the network, they are not providing any sort of like physical recovery tips. Okay? They don't want you recovering. The All-Stars is a shorter season. They're a lot nicer. You can check emails. You can make phone calls. The normal challenge is longer, and it's a lot more difficult physically, mentally, and they would definitely not be looking to kind of make your stay anymore, I don't know, easy.
They want you to really grind.
Yeah, but I think you can bring up. Thing is, if you bring something like this on the show, the likelihood that somebody else has it is 0. So everyone's gonna want to use it. And now it's like, okay, well, I'm going up against this guy. Why would I want him to feel great going into this elimination or this or that? And then you're like, oh no, well, you can't use it. It turns into this whole thing. So
It ties back in those alliances.
yeah, exactly.
Oh man. Personal question. What is your favorite time of the day to work out?
In the morning, right away. I like to wake up, electrolytes, maybe a little coffee, but usually not, and then try to get it in. So I have a saying, and I've said this phrase for a while, but it's earn the day. And I feel like when I work out in the morning, I'm following suit with that statement. So I like working out early in the morning.
Absolutely. No, I'm the same, bro. Like if it's past 12 o'clock, it's hard for me to get into the gym. Like, I'm not gonna lie. Like it needs to happen before the afternoon. So I resonate with that 100%, earn the day. I love it. And lastly, bro, where can people keep up with you on socials, and where and what time can they watch you on this latest season of the challenge?
Instagram is Dario Medrano, is my name. I think TikTok is the same. The challenge is on MTV, which is, normally it was on Paramount, it was streamed. So it's on MTV now. And yeah, that's pretty much all. That's all I got. I don't got much on YouTube. But yeah, Instagram, TikTok, Dario Medrano.
All right, y'all heard it, man. Thanks for hanging out with us, Dario. Thank you for taking time to be out here, man.
Thank you.
Thank you for saying, of course, bro. And I'm excited to watch you more on the show, man.
Thank you, bro.
All right.